Do, 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 do. Do, 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 do.
Hi, welcome to Vitamin Junkies. I'm Jennifer Lyle.
I'm Dr. JJ.
And we're addicted to good health. In today's episode, we're going to be talking about osteoporosis. Before we get there, we're going to see what JJ is taking today.
Okay, so today I am taking calcium and magnesium with vitamin D, which is very fitting for osteoporosis. Usually women tend to take calcium more than men, but nonetheless I like to err on the side of caution and practice preventive medicine. So I am taking calcium and magnesium with vitamin D. There we go.
Very good. And I also take some calcium every day too, but I usually use a liquid form. Seems to be a little bit easier on my tummy.
Calcium, liquid calcium is fine too. Sometimes the taste is a little bit but usually it's pretty good on the tummy.
Does it need to? Is there a difference of whether you need to take citrate or what form of calcium or magnesium you take?
Best form of minerals, period, is the citrate form. So calcium citrate, magnesium citrate, iron citrate, etc. That's the most absorbable form of the minerals. And another thing too, when you take your calcium, just because we talked about this earlier, when you have coffee, when you take coffee with minerals, it actually interferes with the absorption of most of your minerals. So make sure when you take your minerals, you don't take a swig of coffee, you don't chase it down with coffee, because you're still getting some in, but you're kind of
defeating the purpose.
You're defeating the purpose. Thank you.
Very good. So let's talk about osteoporosis. What exactly is osteoporosis, JJ?
Okay, so osteoporosis is low bone density. So osteoporosis, so it's porous bone. So your bones should be dense, should be solid. There's varying degrees of bone density. So osteoporosis is when it is pathological and you're at risk for a fracture. The fracture we're most concerned about is a hip fracture, because when someone develops a hip fracture, there's a higher risk of mortality, there's a higher risk of morbidity. It's not a good thing. Middle of the road is something called osteopenia. So that's where you have a decrease in bone density. So you're almost osteoporotic, but you're not there yet. And then of course, then there's the healthy bone mass.
What causes osteoporosis?
The most common cause of osteoporosis is being postmenopause. So what happens is that your estrogen decreases, and with that you get less of a calcium buildup in bone. So women after the age of about 51, 52 is the average age of menopause. That's where you start to see osteoporosis. That's the main cause. Also too, women at home, if you've ever had your ovaries removed, or you've had a hysterectomy, sometimes with a hysterectomy they leave the ovaries, sometimes they take it out, and that can happen at any time, usually for uterine fibroids. You could have had it taken out in your 30s or 40s, then you'd be prone to osteoporosis.
And what about men?
Men can happen. It is not common. I have a few male patients that have osteoporosis. It's usually more because they're not very physically active, or it runs in their family. There's also a family history, a genetic association with osteoporosis.
And what can people do to prevent it?
Exercise, weight-bearing exercise. So for example, a weight-bearing exercise would be walking, jogging. So that's very good because you put strain on your bones. So when you strain your bones, it makes them stronger, makes them more dense. So a weight-bearing exercise is very good versus a non-weight-bearing exercise, which would be something like swimming. Swimming is a non-weight-bearing exercise. However, swimming is still good, but for building your bones, walking, jogging, playing soccer, tennis, etc., that's a lot better. Eating foods that are high in calcium. So we have a few examples here. We have spinach, which is very high in calcium. Broccoli, which is very good. Dairy, we have a nice little glass of milk. I used to drink about a lot of milk, hence why I'm so tall. You can't tell on the screen here, but if I stood up, you would probably see my knee. There's a lot of sources of non-dairy calcium.
Sesame seeds you were mentioning as well before.
Sesame seeds, molasses. These are all very easy to find online too. Very, very good sources.
Very good. So those are some fantastic tips. Now, how can you find out if you have osteoporosis?
Usually at the age of 45, you should go for bone density scan. So you go talk to your doctor or your naturopathic doctor, and basically they'll order a bone density scan for you. And normally it's done every 2 years, depending on what your bone density is like. As I mentioned earlier, if you've had your ovaries taken out, then you should have it done regularly every 2 years after that.
Sounds painful.
Having your ovaries taken out? I've never had it done. I hear it's, I'm sure it's not fun.
The bone density, I don't know.
Oh, no, the bone density doesn't hurt. All that you do is you just lie on a table. It's a fancy x-ray. Oh. You just lie in a certain position and they check your wrist, your hip, and your spine.
Oh, okay.
Yeah,
So it
yeah,
doesn't
yeah,
sound like
yeah.
it's very invasive then.
No, it's not invasive at all. They're not going in with a big needle and trying to check your bones. No, it's like it's an X-ray machine. Yeah.
Very good. Well, those are some great tips then on how we can prevent osteoporosis, particularly for us ladies.
Yes. Also, too, some other supplements which you'd like to take. So we talked about calcium. So calcium, always with vitamin D and magnesium. That's very good for helping to build your bone mass. Boron, a very good supplement for increasing calcium in the bone. Vitamin K, also a very good supplement for increasing calcium in the bone. And in terms of daily doses of calcium, this is a common question. If you're a woman who is not menopausal, so you're somewhere between 15 to about 50, you should be taking 1,000 milligrams a day of calcium. That's the daily recommended dose for women to straighten their bones. And after you're done menopause, so usually over 52, you should take 1,500 milligrams of calcium a day. That's a dosage.
Pregnant or lactating women?
No, there's no need to modify that.
No, well, okay.
No, yeah, they have a prenatal also, so they'd be supporting that differently. So.
Perfect.
Yeah.
Great. So we've covered all the bases.
Yes, vitamin D, very important too. Yes.
Awesome.
Thank you very much. I'd like to invite you to go to vitaminjunkies.com and fill out our survey for a chance to win $100 in gift pack from Hey Jute. We want to hear what you want to see on the show.
And while you're there, if you want to find a practitioner in the community to help you see if you have osteoporosis or just help you with any health concerns, you can check out the Find a Practitioner section of our website. And you can also subscribe to Vitamin Junkies at vitaminjunkies.com. I think that's it.
Perfect.
Thanks so much for joining us today. I'm Jennifer Lyle.
I'm Dr. JJ.
And continue the addiction to good health.
Do, 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 do. Do, 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 do. Do, 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 do. Do, 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 do.